Good morning, Miss Brewer. I'm so glad that you're going to get to go home today. So, during your stay here, you were newly diagnosed with something called primary hypertension or high blood pressure. This is a very common condition that a lot of people have, and we don't really know why it occurs, but we do know that there's an RAAS system in your body, and it sends out a lot of different chemicals depending on what your signals are. But for some reason, your body is sending abnormal signals when you don't really need your blood pressure to be high. Um, so we need to stop this because if you have high blood pressure, you are at risk of other bad things happening, such as stroke, heart attack, that sort of thing. And there's also a couple other things that could be bad for your health. But with certain medications, like the one that the doctor prescribed for you today, we can lessen the chance of you having those. So I know you're probably curious as to why you got this condition, but sadly we don't know the exact reason. But I know you indicated that you have a family history with your mom and sister, possibly being one of the reasons. And also, I know you're under a lot of stress at your job, and also you have a little bit of a higher sodium intake. And then those two are things that can lead to a higher risk of having hypertension. But we can also come up with certain ways to help reduce stress and cut those excess sodium diets coming with a dietitian. So just call us and we can set up an appointment with them, or just tell us when you're ready. So you've been prescribed with propranolol today, and it helps to bring your blood pressure down. So this medication is known as a beta adrenergic blocker. So it's mostly called a beta blocker. So it works in the heart with beta 1 receptors, and then it works in the lungs with beta 2 receptors. Some medications only work on one certain type, but this one is kind of non-selective, so it can work on either one or both. So the blood pressure in your body is reduced when nitric oxide is increased, and works to widen your blood vessels out. It's called vasodilation. And then also the beta receptors are stimulated to decrease your heart rate and how strong your heart pumps. And that helps to lessen the blood pressure. So beta blockers do have a few side effects that we do want you to watch out for while you're taking it, especially during the first few weeks. You might see some. So just to clarify, you don't have asthma or any lung conditions. Okay, good. And then you don't also have any diabetes or anything like that. Okay, that's great. I just wanted to double check, because this type of beta blocker can work in the lungs, which is not good when combined with asthma and lung conditions. And it also can hide low glucose levels, called hypoglycemia, and prevent a higher heart rate. So it's a little dangerous for people with diabetes. So there are two main things we want you to watch out for. So first, watch your blood pressure. I know you brought your home blood pressure cuff with you. That's great. We'll teach you a couple things here. So just make sure this top number here, this is called the systolic blood pressure. Make sure it does not go below 100. And then also this number here is your heart rate, and make sure that doesn't go below 60. We might have you come back here soon, maybe in a couple weeks or so, to check your blood pressure and heart rate to make sure that that's within the limits that we want you to be in. So another thing to watch out for is being really tired and not wanting to get out of bed, get going, that kind of thing. And this side effect's pretty common and sometimes really severe. So just call us if this is an issue for you and you'd like to change the medication or something. Just please do not try to stop taking it all of a sudden, because that'll cause your blood pressure to go way up and can cause really bad problems. So we'll have you come back in a couple weeks to make sure it's going down, the medication's working. If you want, you can take your blood pressure at home and write down the numbers just to see what it is. And then also try to work on your diet. I know it's a little harder to reduce that sodium intake, especially with fast food and everything now, but just try to stay calm when you're stressed also. That would be a big thing to really help your hypertension. And we want you to stay healthy. So I know that was a lot of information at one time, but can you tell me what you're going to do when you get home? Okay, thank you.